Nancy Pelosi, the Speaker of the House, is going to be bringing her health care bill to the floor on Saturday, and I think you ought to know why I'm voting against it. This bill is going to cost $1.2 trillion that we don't have. It's going to raise taxes by $730 or $740 billion. We don't know for sure because we haven't gotten all the figures from the Congressional Budget Office. It's going to end up rationing health care, and it's going to take almost $500 billion out of Medicare and Medicare Advantage, and that's going to hurt seniors. It's just a terrible bill at a time when we really don't need to be raising taxes because we've got severe economic problems right now, and tax increases just creates more problems. You know, I had 2 town meetings last week, and I had a couple of town meetings a couple of weeks ago, and the town meetings I had 400 to 500 people attending, and probably 98% or 97% of the people said they don't want the government to come between them and their doctors. They want a plan that'll deal with the problems that we face, helping the people who are uninsured, making sure that businesses can band together to buy insurance like major corporations, allowing people to buy in a more competitive way across state lines. All these things are very, very important. But Nancy Pelosi, the Speaker's bill, is a bill that will not deal with those problems that way. It will create a barrier between patients and their doctors, the government coming between patients and their doctors. And that's something we just don't need. These decisions should be made by patients and their doctors and not by some government bureaucrat. So I'm going to be working on an alternative, H.R. 3400, and a couple of other bills we're working on that will deal with the problem in a sensible way without raising taxes on everybody during a severe economic problem like we're facing right now. The people in this country don't want government-run health care, even though the Speaker and the Democrats in Congress are going to try to ram that thing through.